Senator Rennick, over to you.
Okay, cheers. Thanks, guys. Could I get the numbers of, if it's possible for you to provide on notice, the number of doctors and nurses and ambulance drivers or paramedics that have been registered from 2019, 2020, 21 and 22, just to get the last 4 years, if that's possible. And just in regards to, I'll pick up on that position statement, and I noticed Professor Murphy said the best available evidence, and that's a good point, because the FDA on December the 2020th came out and actually said that Pfizer said that data was not available to make a determination about how long the vaccine will provide protection, nor is there evidence that the vaccine prevents transmission from person to person. Now, ATAGI has come out in updates from September to December 21, and ATAGI has stated that vaccination was an intervention to prevent infection transmission. So they have contradicted, ATAGI has contradicted what the FDA has said about transmission. Now, that is a good example of how the so-called experts, many of whom work for universities that receive significant funding from Big Pharma, as well as, the likes of Bill and Melinda Gates Foundation, who are heavily invested in vaccines, didn't get the data right. So why should we trust the regulatory experts over the expertise of individual doctors and nurses and paramedics, who quite rightly have raised the risks, and I've just spoken about this with the ACCC and the CEMA? Why are they being suspended? So you've been clever with words when you're saying no one's been sacked, but plenty of people have been suspended, and there is a culture of fear amongst doctors and nurses.
Sorry, could senators at the table just allow Senator Rennick to ask his questions? It's just hard to follow. Thank you, Senator Rennick.
Thank you. So I guess my question is, what have you got to say when ATAGI gets it wrong? And they've clearly got it wrong in regards to transmission.
That's an appropriate question for the CEO of AHPRA about the veracity of ATAGI's advice, Chair.
Well, that's who there's advice they rely on.
Yeah, ATAGI's advice. We are very happy to defend ATAGI's advice and the evidence upon which it's based, but I don't think that's a question for the CEO of AHPRA, frankly.
So now you're running interference. My question
wasn't
to you.
No, I'm not running interference. You can ask questions about regulation, but I don't think you can ask questions.
Can you not interrupt? The question isn't to you. The question is to you, Mr. Fletcher. There is a culture of fear, okay, because a lot of doctors who have much more expertise than many of the so-called experts on the ATAGI board have, knowledge about the risks of mRNA, etc., and they have been shut down, suspended, or threatened to be suspended. Why will you not take their advice or let them use their own discretion based on their significant expertise, as opposed to those in ATAGI who don't have the same level of advice? Expertise, sorry.
So, again, I think it's important that we sort the fact from the fiction here. So let me just go back to the data in relation to the notifications that we've dealt with. So if I can just complete my answer to the previous question. In fact, of those 1,300 notifications we received, around 50% of those, this is at June this year, had resulted in no further regulatory action. In other words, we'd looked at the matter, assessed it and decided there was nothing that we needed to do as a regulator. You're right to say there are practitioners that we have suspended from practice, and there are 28 practitioners who we have suspended from practitioner in relation to COVID-related matters. It's important to note, first of all, that suspension is an interim measure whilst we undertake an investigation, and we can only do it where there is a significant concern about public or patient safety or a public interest issue that requires us to take that action while we look further at the concerns being raised with us. And if I just give you the flavour of those, 11 of those suspensions were in relation to conduct related to spread of what you might consider COVID misinformation. So, for example, claims that COVID-19 was fake, that vaccine programs were government-led mind control, just to give you an example. 10 were suspended because of their failure to comply with public health orders, serious or at times fraudulent behaviour, so fake vaccination administration certificates or fake exemptions. Sorry, I should say that's 28 practitioners subject to immediate action, 21 suspended, 11 and 10, and then 7 are subject to restrictions or conditions such as supervision or limitations in relation to their vax exemption or prescribing.
Okay, thank you.
So can I just make the point, there are 830,000 registered health practitioners in Australia, so the vast majority of people
thank you. I'm on limited time here. So have you employed staff to look at doctors who have been writing exemptions or adverse events, and think very carefully about this statement, to actually been red flagging doctors who've been writing exemptions to the vaccine?
So because of the number of notifications that we received about COVID-19, we set up a special COVID task force within our existing staff, and we also worked particularly with the Medical Board of Australia to have a special committee that dealt with all of the COVID notifications in relation to medical practitioners.
So you were red flagging doctors who were writing?
No, we're not red flagging. That was in response to the notifications we were receiving. We were not out there doing surveillance, if that's what you're asking. We were responding to the notifications we were receiving.
Well, that's not what an AHPRA employee told me. But anyway, so I'll finish on this. I have been told by numerous doctors or numerous people with vaccine injuries that they have gone back to get an exemption. They've been forced into getting a second shot to keep their job. They have gone back to try and get an exemption, and the doctor will not write it. They are afraid to write exemptions for people who are injured by the vaccine. And in response to, I know Professor Murphy didn't believe me last time when I said that, so I put up a post. I got 7,500 people who were sacked because they wouldn't get the second shot, and of that, 407 were both injured and sacked. So that's the culture of fear that is out there. You're going to have to live with that, and that is a shocking indictment that we are living in a country where people are being forced to get injured.
Can I ask you to direct it as a question, please? Thank you.
Okay. So my question is that we have got doctors out there. Why have we got doctors out there who are afraid to write exemptions for people who've been injured by the vaccine?
Well, obviously we do not want doctors to be fearful of AHPRA and the regulatory scheme. We are here to support professional practice, but I don't step back from the fact that our fundamental focus is on public safety and patient safety, and if concerns are raised with us about risks to public and patient safety, we're obliged to look at those concerns. The law requires us to look at them, and if there's a need for us to take regulatory action, we will take it. Now, in the majority of notifications we deal with across the board, we don't need to take regulatory action, but we don't step back from needing to do it where there is that risk to public safety.
Okay, so you will defend the right of doctors to apply their own discretion to people who've been injured by the vaccine?
We defend the right of doctors to use their professional judgment and the best available evidence, and as I've said earlier, in our view, the best available evidence is that is provided by public health experts in each of the jurisdictions, ATAGI and TGA, and where needed, at the more serious end of concerns that are being raised, we would also seek expert opinion.
But evidence in a trial doesn't outweigh a diagnosis of an individual. It's the dignity and worth of every individual that matters. If a doctor diagnoses a patient, okay, so I've got a son who's allergic to penicillin. I know it's a commonly used drug. It's safe in most cases, right? Everyone has different allergies. Are you saying that the public evidence based on a trial is going to outweigh an individual doctor's diagnosis of a patient?
I'm saying that we refer to those sources of expertise if we've got concerns raised, but we look at the merits of the individual case. This isn't a one-size cookie-cutter-fits-all. We look at the individual circumstances, and that would determine whether we came to a view that there was a public safety risk that needed regulatory action.
Okay, thank you. That's all I need to know. Thank you.
Thank you, Senator Rennick.
Authorised G. Rennick, LNP Chermside.